Hey everybody, my name is Brent, and today I will be doing my project over ADHD. What is ADHD? How do we cure it? How we put a handle on it somewhat. So let's get right into it. So ADHD is a disorder that I've been seeing diagnosed more and more young kids today in today's time. But have you ever thought about why? Many can't even tell you what ADHD is. Most of them be like, well, my child don't pay attention, all this, that, and the third. But they can tell you this also. They be like, well, my doctor said the kid had it, or my child has it. And you be like, okay. I mean, yeah, kids are hyperactive, but we now, as a society, have pushed for tablets, smartphones, and other electronics to take the child's attention. So when a child is being a child, we may mistaken them for being hyperactive. But first, we need to actually know what ADHD is, and for ones that have it, how we can treat it and somewhat put a handle on it. ADHD includes learning disabilities, intellectual disability. It can lead to some autism, spectrum disorder, and your attention deficit hyperactivity disorder, which is ADHD. Learning disabilities can become evident when a child of average intelligence has difficulty mastering basic academic skills, such as, learning disabilities can affect the child's ability to listen, speak, write, and perform your basic everyday mathematics, which we all can get a little tricked up with mathematics, but thank God for calculators. So for an example, we'll have, children with dyslexia. They may have difficulty reading, writing, spelling. Children with dyscalculia, I can't even pronounce it, has problems with mathematics and computation. Then you have children with dyspraxia. They have problems with manual dysarexity and coordination. Then you have children with dysgraphia, which they have difficulty producing and writing words with composition, spelling, and writing. About 10% of children and adolescents have learning disabilities. And in children with chronic illness, learning disabilities are 2 times more common than in general population. Intellectual disabilities refers to a functional state in which there are significant limitations in intellectual status and adaptive behavior, which is, functioning in daily life, developed before the age of 18. Intellectual disabilities occurs in about 1% of the population. ADHD is the most common neurodevelopment disorder of childhood. It affects about 8% to 11% of school-age kids. It's characterized by inattention, impulsivity, distractibility, and hyperactivity. It leads down and breaks down into 3 subtypes of ADHD. You have hyperactive, impulsive, inattentive, and combined. So the child with ADHD has a disruption in learning ability, socialization, compliance, placing significant demands on the child, parents, teachers, and within the community. You will notice many things that a child will have with ADHD. They will frequently do certain things, but in order to be diagnosed with it, they have to have 6 or more characteristics to be diagnosed with ADHD, and have to be 17 years of age or younger, and include failure to pay close attention, with distraction. My cousin, he has ADHD, and he can't pay attention for nothing. He has a very short attention span, so when I think of ADHD, I think of him. They don't listen. Well, yes, they don't listen, but they listen at the same time. So you can tell them one thing, but they really just don't comply with it. They don't follow through with certain commands. They don't understand certain instructions. They're very poorly organized and forgetful and fidgety and squirmy. They always out of seat. They talk excessively. I may do that sometimes. They blurt out answers. They're very difficult when waiting in turn, and often they interpret it and intrudes on others. Those are a handful of symptoms that they look for, and you got to at least have 6 of those. And that was just a certain handful I named off. Medication is heavily used to treat children with ADHD. such as psychostimulants, non-stimulant norepinephrine, reuptake inhibitors, and antagonist antihypertensive agents. Here we have a little bit of it's a psychostimulant that they use, and it helps calm them down, which sometimes this can have the opposite effect and wire them up. Now, I've always been told that kids that really don't have it, it has the opposite effect on them. So, like, I have two cousins, Jeremiah and Destiny. When you give this to Jeremiah, he is focused. Like, he can get all his work done. He's following commands. He's acting like how a normal child should act coming up. Now, when I give it to Destiny, she goes far left. She is jumping off the wall, talking so much. And it's just like, is this medicine really working or what? Because I don't think you got it. But supposedly she was diagnosed when they were younger. Now they're 14 and 17. And I can tell the difference when they first got diagnosed until now, which the medicine has helped with Jeremiah especially. Now with Destiny, I think it's starting to do the opposite effect. Your main meds, such as Adderall, Ritalin, and Concentra, your most commonly used meds. And that was the name I was thinking of, Adderall. Within these meds, we want to also include behavior therapy and classroom reconstruction to help these children. Before we have a small before just having a child medicated, because a parent believes that they need to be medicated, we can try other alternatives to help the child. Medication isn't always the go-to fix, which, everybody, hey, give them this pill, give them that pill. But it's other things we can do. Some children do need the medication, but does the parent actually give the child attention that they require? Children do have a lot of energy nowadays. We have lost the focus of letting kids be kids and just letting them go out and play. A child full of energy want to be on the move constantly. Keeping them still and quiet can be a difficult task, especially when they're younger. So you want to have them involved in activities that help burn off their energy. It could help them focus a little better. CDC recommends that children need to be active for at least 60 minutes every day, depending on their physical status. So I feel like we can get these kids out the house, off the phones, off the tablets, and let them go play. Now, what roles do the doctors play with the diagnosis of ADHD? Let's talk about that. The doctor will talk with the parents about ADHD symptoms that they may have seen in their child. The doctor will want to know what age the behaviors begun and where and when the child shows symptoms. The doctor may also ask for a behavioral report from the child's teacher. He want to see report cards and samples of school work. That can show a trend, how a child is doing in school. That could be left, right, all over the place. Because normally when they got ADHD, they can't focus. So if you got a child that can't focus, how do you think a child is going to do in school? Not just absolutely so well. And also, majority of the time throughout the school year, your child is with the teacher. So your teacher going to see a lot of this stuff because they with them at least 8 to 9 hours a day. So that's always one good place besides other than the parents to get a baseline. Doctors may use certain tests and or rating scales to help them track ADHD symptoms. One tool is called the Vanderbilt Assessment Scale. Now with this scale, this is a 55-question assessment tool that reviews symptoms of ADHD and also looks for other conditions such as conduct disorder, oppositional defiant disorder, anxiety, and depression. Because there's a handful of things, a couple of things you will see with children with ADHD. Another thing they use is the Child Attention Profile. It's also known as CAP, C-A-P, and it's generally filled out by the teachers and track common ADHD symptoms. That's why I was relating back to what I said earlier. They with the teachers a lot of times, so the teachers can kind of tell you and give you a general idea of what they see, what they're dealing with, and how the child react within the classroom with others. Another scale that's used will be known as the Child Behavior Checklist and Teacher Report Form. Now, this scale here focuses more on the physical complaints, aggressive behavior, and withdrawal. ADHD kids, yeah, they're very hyper, but when hyper comes with, well, a lot of times it can come with aggression, which they might not see it as aggressive. They just being, who they are. But to us, like, whoa, he got a little bit more extra in the tank. He always doing this and that, and he a little rough on the edges, but that's just part of it. Now, with ADHD, we must realize where the problem is coming from and help and correct that problem. Every child in the world is different, so what works for one child may not work for another child, and we must keep that in mind. Now, it's no absolute cure for ADHD, but as described earlier, it's a couple things we can do to help reduce a child from being so hyperactive and to get them to calm down and relax. And that is my presentation.